Ezron, have you opened up?
Yes, I've just opened it up.
Okay.
Ngoma, did you say something?
Yeah, he's just packing. Sorry. Now, Hezron has opened up, so maybe let's chat.
Oh, okay.
Esteemed members, good evening. If you can hear me, just send a message on the chat. Let us know which branch you're joining us from. Thank you, Dr. Benjamin from Kisumu. Welcome. Dr. Sorej, good evening. Welcome to this webinar. Dr. Azmina from Calm Pharmacy, welcome. Thank you for joining. Dr. Mudhoni from Tanzania, Dr. Mageto from Jack's Pharmacy, Kisii, Dr. Sangita, Dr. Wycliffe Nandama, welcome. So meanwhile, as we wait for our colleagues, kindly go to the PPB portal and search for this event. The keyword is self-care. So just search for the word self-care and you'll be able to find this event. So kindly subscribe. For those who've not been receiving their CPD tokens, kindly send an email to operations@psk.or.ke, and that issue will be sorted out. Operations@psk.or.ke. If you've not received any CPD tokens for any activity that we've had, just send an email to operations@psk.or.ke. I'll send the same email to the chat. Thank you for joining, Dr. Anish, Dr. Mike, Dr. Walter, Dr. Ruvin Barij, Dr. Zakir, welcome. Thank you for joining us. For those who are joining now, kindly subscribe on the PPB portal. The keyword for finding this event is self-care. Just search and you'll be able to find this event on the portal. And for those who've had issues with their CPD tokens, kindly send an email to operations@psk.or.ke, and that will be sorted out. Dr. Richard, Dr. Fanis, karibuni sana. Meanwhile, as we wait for our colleagues to join, maybe you could mention what you think self-care is from your own perspective. You could utilize the chat to just let us know what you think self-care is in your definition. Welcome, Dr. Tom, Dr. Sylvia, karibuni sana from Bungoma County. Thank you for joining. For those who are joining, kindly subscribe on the PPB portal. The keyword for this event is self-care. Remember, the earlier you subscribe, the earlier you receive your CPD tokens. When there's a delay in subscribing, we have an issue with receiving the tokens. That's why they are sent out late. So kindly subscribe early. All right, thank you. I see we are now at 200 participants. So we'll just do a quick introduction. Then after that, we continue. So welcome to today's webinar. Today's webinar is on self-care. And our speaker today is Dr. Nyamu, who's the National Coordinator at Reproductive and Maternal Health Consortium Kenya. And our partners for today's event is DKT International, and we have their representative, Helen Karoki, who's the Program and Business Development Manager. Just before we get started, I'll just take you through a few ground rules and announcements. And first is to thank you for participating in this session and to remind you that you'll be muted during the entire course of this session. If you have any questions, kindly use the Q&A tab, and then the presenter will respond to the questions at the end of the session. If you've not already done so, kindly subscribe on the PPB portal. This is the keyword for the keyword that you can use to search for the event on the PPB portal easier. Remember, this session is being recorded, and it will be provided on the PSK YouTube page later on. So at this point, I'd like to welcome our first speaker, Dr. Michael Mungoma. Dr. Mike.
Thank you so much, Hezron, and welcome everybody to our webinar session. This is part of the many sessions that we have as part of continuous professional development for pharmacists organized by the Pharmaceutical Society of Kenya. And for those that are joining in for the first time, welcome. This is what we do as part of continuous medical education. For me, I think I'll just take you through a very brief session here. This is part sensitization, part just updating everyone that we now have a national guideline for self-care interventions in reproductive health. Next. Yes, and these are just part or some of the features that could interest us. That with self-care in the context of interventions linked to health system is self-management, self-testing, self-awareness. With management, we need to be aware of self-medication, self-treatment, self-examination and self-injection, self-administration and self-use. Then self-testing. Again, if you look at the three, it's all about empowering the client and making sure that there's a holistic approach to things so that we can achieve what we want. So next. This is the cover page of the National Guidelines for Self-Care Interventions in Reproductive Health. As you can see, it was launched this year. For PSK, we want to ensure that all our members are able to access this. The office has already shared soft copies through our social media pages, especially the WhatsApp groups. So members are urged to familiarize themselves with these self-care guidelines just to improve what they do at their workstations, and also support the self-care initiatives by government. Thank you for that. So at this point, I will invite our speaker. I see he has joined us, Dr. John Nyamu, who is a consultant gynecologist and was introduced earlier by Dr. Hezron. We are very honored and privileged to have you this evening to take us through your session. So Dr. Nyamu, welcome and take us through.
Thank you, Dr. Mungoma. I think you are allowing me to share my screen, and I hope everyone is hearing me.
Yes, we can hear you loud and clear.
Okay, let's see whether you can open the slides. So now, as you have been told, my name is Dr. Nyamu, and I'm an obstetrician and gynecologist, and I'm the coordinator of the Reproductive and Maternal Health Consortium, which is in a partnership with the Ministry of Health to develop policies, standards, and guidelines. So the work I'm going to present is part of what we have been doing with the Ministry of Health, and currently we want to disseminate these guidelines to healthcare providers in the counties and also among the pharmacists. And that's why when I was invited for this presentation, I was happy to come and share some of the information that we have concerning self-care. Although the topic is just general on self-care, we are going to discuss much about sexual and reproductive health, self-care. So by definition, the self-care definition by WHO, self-care is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, cope with illness, and disability with or without the support of a health worker or healthcare provider. So you should note that self-care does not necessarily mean that the person themselves will only support themselves without a healthcare provider, but the healthcare provider is very important as part of self-care. And that's why pharmacists and also other healthcare providers are important when we are discussing about self-care. So from the WHO definition of self-care, the scope includes health promotion, disease prevention, self-medication, giving care to dependent people seeking hospital, specialist or primary care when needed, rehabilitation, including palliative care. So you can see the scope is actually quite big, but I think for this presentation, I'll be talking about how people can promote their health, self-medication, maybe seeking hospital, specialist or primary care when needed. I don't think we have much on rehabilitation and also disease. Okay, we can do a bit of disease prevention also. So the scope of self-care is quite diverse. What kind of self-care do we need as human beings or as persons? Sometimes you can have self-care for good health, whereby you can say that you are going to take water, you sleep, you rest, living food, you take food to live, exercise, detoxification, supplements, and coping with the stress. That's why if you are doing self-care for good health, self-care for wellness, if you want to have at least to have a good life and you are well and your physical health is good, then there you look at 8 dimensions, that is physical, intellectual, emotional, social, spiritual, vocational, financial, and environmental. And actually there are several other things that you can do for you to be well. And here you can note that spiritual and also social is part of the self-care. So self-care, when you are feeling unwell, also you can stay at home, you rest, you can hydrate yourself, you take water, warm tea, broth, increase your fluids, treat your symptoms, eat well, or you visit a doctor or hospital. That's part of the self-care. And then when you're looking at self-care for sexual and reproductive health, we look at priority areas that fall under SRH, that is under sexual and reproductive health. And you see how to promote your health, self-medication, disease prevention, seeking hospital intervention. This is what I'm talking about when I mentioned about the scope. As far as the sexual and reproductive health is concerned, these are some of the areas that one may need to look at. So, as Dr. Mungoma said, the self-care concept has got 3 elements. The first one is self-awareness, self-diagnosis, and self-management. So basically, you are supposed to be, if you look at any of the sexual and reproductive health themes, you will find that if you want to have self-care in those themes, then you have to be self-aware of what you want to have. Then you make your a self-diagnosis and you manage yourself, self-management, of course, including referral and also seeking care from a hospital. So since we are looking at sexual and reproductive health self-care for today, what is the definition? The definition is that self-care, sexual and reproductive health self-care implies that people are able to have a satisfying and safe sex life and have the capability to reproduce and have freedom to decide if, when, and how often to do so. It is the ability of an individual to support our sexual and reproductive health with or without help of a healthcare provider. Again, you should see that we are actually involved in self-care. SRH self-care interventions include self-injection. These are examples actually, like contraceptives. If you are looking for contraceptives, you are doing like self-injection, that's self-care. Self-screening or testing, that is for STDs. You can test yourself. Like in HIV, you can buy a kit and test. Pregnancy, you can buy a kit and test. And you can see, of course, pharmacists are involved in this, because they are the ones who are providing these test kits. Self-medication, for example, for PAC, post-abortion care, and HIV, you can go and buy medicines, and then you treat yourself with that medicine. And the self-monitoring, for example, in fertility, you can monitor whether you are going to conceive or whether you have an issue with fertility. So basically, the definition means that when you are talking about self-care, medically is where you are going to do it yourself, but with the support of healthcare providers. So these are some of the examples in pictorial form. You can see HIV testing is one of the self-care. Pregnancy tests are one of the self-care. Ovulation predictor kits, if you want to do your pregnancy test or ovulation testing, that's self-care. Self-management of abortion complications is self-care. And HPV testing also as part of the self-care. So where did this idea of self-care come from? Now, in WHO, they produced this WHO consolidated guideline on self-care interventions for health. In the first one was 2019, and of course, there's another one which came in 2022. So actually, what we are doing is that we are domesticating what WHO as undevised, because World Health Organization is the umbrella body which actually guides in health in all over the world. So actually what they have guided is that there should be guidelines on self-care interventions for health and well-being. So for the Ministry of Health, they domesticated this WHO self-care guidelines, and they produced national guidelines for self-care interventions in reproductive health in January 2023. And recently, they also produced self-care interventions in reproductive health facilitators guide. There is a guide which is going to help people like us or trainers like us to go to the counties and support the healthcare providers and also pharmacists, so that at least they can get this knowledge which is in these guidelines. Also, post-abortion care standards and post-abortion care guidelines are some of the other guidelines which have been produced by the Ministry of Health, which is going to support, or which are going to support the self-care. And the same case also, there are two recent guidelines which are related to self-care approved in May 2023. One is called the Big Five, and the other one is CombiPack. And of course, this Big Five actually is a clinical handbook on the prevention and management of the Big Five direct causes of maternal morbidity and mortality. And it gives details of all the conditions that affect mothers, especially during birth, and where women can die because of these complications. And these are the guidelines, the national guidelines on mifepristone and misoprostol combination is called CombiPack because it's a combination of mifepristone and misoprostol. And also it can be used by pharmacists and other healthcare providers. So on this MOH policy and guideline on self-care, phone consultation is allowed. It's very important to know that a client can call you. You can consult on phone. If you want, you can charge the client. You can do it for free, but you can advise the client how to get the medicines. That referral also is indicated in these guidelines. Women can seek care from the nearest health facility at any time during the process of self-care. In case they have any complication, there's an indication that they are supposed to seek care from the nearest healthcare facility and also from the nearest healthcare provider. Termination of pregnancy through self-care is allowed in cases of early pregnancy complications like the blighted ovum, missed abortion, intrauterine fetal death, and complications not compatible with the life. For example, if somebody has got gestation of trophoblastic disease, or there's a pregnancy which is not compatible with the life and the pregnancy must be terminated. So that one is allowed by the Big Five and also by the CombiPack guidelines. CombiPack will be tendered and procured by KEMSA to allow women to use it to manage early pregnancy complications. And of course, CombiPack is also in the Kenya Essential Medicines list. It was tendered in March 2023, but again, it was one of the casualties. All the tenders were cancelled, and it did not appear in the tender of August, but there's a possibility that this combi pack is going to be tendered again and to be available to be used in the county since the ministry has developed these guidelines. Ultrasound may be needed to make the above diagnosis of early pregnancy complications. This is important because some of the clients who come and tell you they have incomplete abortion, you have to check whether they have an ultrasound or if there's a way, how was the diagnosis arrived at. PAC or post-abortion care is also allowed as an emergency service and includes management of these early pregnancy complications. So if someone asks you about the policy on this PAC and also about the use of these medicines, then you should have these guidelines which I've given you the pictures, the pictorial up there. Let me show you again, the big five, the combi pack, the national post-abortion care guidelines, post-abortion care. This is the PAC guidelines. And then also the self-care guidelines, which is indicated, which is shown there. So basically, for you, sexual and reproductive health, thematic or priority areas. These are actually the priority areas which are indicated in the self-care guidelines. This is what the pharmacist can be able to assist the clients to manage their conditions. And you can see there's maternal and neonatal health, early pregnancy complications like abortion and miscarriage. You can guide the client to manage this. Post-abortion care, contraception and family planning, infertility for male and female, STIs, HIV, menstrual hygiene, sexual disorders like erectile dysfunction, premature ejaculation, SGBV, that is sexual and gender-based violence. You seek help from a health service provider or a police station or chief. Menopause and andropause, reproductive tract cancers and breast cancer. Adolescent and young people, SRH, teenage, for example, teenage pregnancy, cross-cutting issues are many, like in dysmenorrhea, hormonal imbalance, and menorrhagia. So these are the 12 or the dozen conditions where pharmacists can be able to assist the women to manage. If they come for help, then you should look at these conditions and know that they are allowed by the self-care guidelines. So what are the role of the pharmacist in self-care? For example, post-abortion care, the PAC. I'm just trying to pick a few of the 12. You can look at, during post-abortion care, there is medical uterine evacuation. This is the terminology which is used by the Ministry of Health in the PAC guidelines. So instead of saying medical abortion, we talk about MUE or medical uterine evacuation. You can also look at contraception and family planning, and I'm sure a lot of pharmacists come across this contraception and family planning. There's STI, HIV, erectile dysfunction for male and female, cross-cutting issues like dysmenorrhea. You'll find our client coming to ask for medicine for dysmenorrhea, menorrhagia, menstrual hygiene. Like they might come to buy pads. Infertility, they might come to us for ovulation test kit and SGBV. They might come and tell you that they have been raped. So you find out how you can assist them and the type of advice that you can give them. So basically, looking at all the priority areas, the 12, the pharmacies, you can actually do all of them, all the 12, but at least for today, I'm going to discuss, I just go through a few of these. Looking at medical uterine evacuation in PAC, the self-managed medical uterine evacuation, how can women manage themselves if they have got early pregnancy complications? This one, in most cases, the client may be in consultation with a healthcare provider to confirm the pregnancy by pregnancy test or ultrasound, and if there is a complication, if they have a blighted ovum or they have missed abortion or intrauterine fetal death, then they are going to come with an ultrasound and tell you that you need these medicines to manage this condition. And the requirements for conditions for self-managed medical abortion or medical uterine evacuation. Then gestation should be less than 10 weeks. Women should have a source of accurate information. I think this is something which you must insist You should not sell medicine to a client if you don't have any accurate information. You can even call the provider, or you tell the client to give you the notes from the hospital or the clinic. And there is also need for referral in case of complications. And it should be allowed by law on government policies. And of course, I've showed you some of the policies that allow this self-care. That is the Combi Pack, the Big Five. We talked about the pack guidelines and also the self-care guidelines. And I'm still insisting because on ultrasound, because sometimes you may need to ask the client to confirm whether there is an issue with the pregnancy before you manage this client. And where do clients get drugs for use in pack? Okay, they can have these drugs from healthcare providers, pharmacists. Very important because pharmacists the pharmacy shops are so many. There are even more than healthcare providers clinics. You can also have them in from online sellers, telemedicine, social workers, or community health workers. Like currently, the government is going into community health workers, so I think we are going to get a lot of information. These community health workers may be given these medical uterine evacuation drugs. So for self-management of incomplete abortion or PAC, the dosage of misoprostol is 3 tablets. That is about 600 micrograms, which is taken orally, and the client will come back after 1 week. Alternatively, the client can take 2 tablets of misoprostol. That will be 400 micrograms in total, and they come for follow-up after 7 days. Or if there's an early pregnancy complication, 10 weeks and below, you can either use misoprostol only, whereby you give a total of 12 tablets, 4 tablets sublingual every 3 hours for 3 doses. That is a total of 12 tablets. These days, you don't give a 2 up, 2 down. This one is a theme of the past. Since 2012, WHO recommended that for uterine evacuation, you must use 12 tablets. You should not use 4 tablets, 2 in the mouth and 2 in the vagina. But you give 4 tablets sublingual every 3 hours, 3 doses. That comes to 12 tablets. So the Combi Pack is another one whereby it's a combination of mifepristone and misoprostol. This is actually the best combination for uterine evacuation. So you give 1 tablet of mifepristone, 200 milligrams orally, and on the first day, and on the second day, give 4 tablets of misoprostol, 200 micrograms. That's a total of 800 micrograms under the tongue. That's sublingual, and wait for 2 weeks for them to work. In the case of any complication like excessive bleeding, where a woman can be losing blood, like two or more pads in an hour, then they should visit the nearest healthcare facility. And these are the brands of Combi Pack in the market. There is Medabon, which is being marketed by Via Health Enterprises, and manufacturer is Sun Pharma, Maristoops from Acme Laboratories in India, MA Care from DKT. This one is from Nari, India, and the Safety Kit, Lord Healthcare, and from Janani. So basically, these are some of the brands that you'll be able to get in Kenya. And since DKT is in the house, you'll be able to tell us about the MA Care. Although some clients will come and tell us they want Makare. But I think the proper pronunciation should be MA Care. And what are the source of information and source of drugs and referral channels by satisfied clients, service providers during training, hotlines, websites, apps, and social media? So what is the safety of self-managed medical uterine evacuation? As long as the uterine size is 10 weeks and less, it has been proven that any early pregnancy complication can be managed safely using the medicines. With the advent of medical abortion or medical uterine evacuation, the practice of managing abortion complications without a form of supervision of a healthcare provider has become safer and more widespread. So I think the use of Combi Pack has been quite useful, and it is actually the best method of terminating a complicated early pregnancy. So when do women resort to self-management cold-train evacuation in case they experience early pregnancy complications? I think one of the reasons is because of restricted by law, where access in the formal system is limited. Availability of abortion care may be limited by health worker shortages or and that of trained and willing abortion providers may be absent. You remember, even if it's post-abortion care, there are some clients who may not, the providers who may not want to deal with any abortion cases. Whether the woman is in a danger or not, they don't want to see blood, they don't want to assist any woman. That's why I'm saying that there might be shortage of service providers willing to provide those services. So, and also the facilities may not be there. Procedural and administrative requirements is another issue, and women often face stigma and mistreatment and violence when seeking abortion services and care. So this is again just a reminder, if you are doing PAC, and either for early pregnancy complications or any other cause, incomplete abortion, then there are three things involved. Self-assessment of eligibility, determine the gestational age. We talked of 10 weeks. Self-administration of medicines, you remember the dosages. If it's incomplete abortion, you take 600 micrograms of misoprostol. But if you are doing evacuation of uterus using Combipac, then you give mifepristone 200 milligrams oral, and the following day you give 4 tablets of misoprostol sublingual, and then you give time to work. And of course, the self-assessment of the success of the uterine evacuation. So the medicines used in self-managed medical uterine evacuation and how it's done, again, is like a repetition. If you are doing misoprostol only, 4 tablets of misoprostol, 3 hours, 3 doses, you give a total of 12 tablets. And if you are giving Combipac, the first day you give 200 milligrams oral, and the second day you give 800 micrograms of misoprostol sublingual. And uterine evacuation is expected anytime between the second day and the 2 weeks deadline. So the advantages is that of course is it empowers women and girls and other pregnant persons, and it's also the self-management can be appealing for several practical reasons, including lower costs, use of scheduling, reduced transport needs, availability of how to manage stigma, and the ability to avoid delays in the receiving care. So those are some of the advantages, and of course disadvantages. There is risk of complications, and in case of extrauterine pregnancy, the medical uterine evacuation will not work, so it is contraindicated, and this is one of the reasons why we must make sure that the woman we are treating does not have an ectopic pregnancy, and they may need to do a biomanual examination, or maybe you ask the client to do an ultrasound. The women fear complications unless they are in touch with a healthcare professional whom they can ask questions in case of any worries. That's why you are saying that sometimes when you are dealing with the sexual and reproductive health conditions, then the client needs counseling, and you need a contact with a healthcare provider. The availability of medicines like Combipac is limited to urban centers and giving rural women a disadvantage. And also the cost of the medicines is a bit on the higher side. So after taking the medicines, of course, the self-assessment for completion, and also there's an option that women can take a contraception immediately after the evacuation has been done. So the success of self-managed medical uterine evacuation, there's information and support that is needed. Supportive health systems like pharmacists and others who are trained. Quality products like we have talked about in the Combipac, and the policy and regulatory frameworks which already are existing in Kenya, but we have given you several policies like self-care, Big 5, Combipac, and the PAC guidelines. although the current status, self-care is weekly regulated. That's why we are trying to see whether people can be at least be exposed to this knowledge that self-care is there and the products are there. And also there's an issue of wastage. I mean, wastage whereby waste disposal, whereby condoms, menstrual hygiene products need to be regulated, and self-diagnostic kits also, and innovative self-injection mechanisms with sharps also needs to be regulated. So for contraception and family planning, this is another area whereby pharmacists can work. If I can remind you the list, we have 12, and we have just tackled only PAC, and these other ones like contraception and family planning, infertility, STI, HIV, sexual disorder. I will just mention them because I think I'd been to talk about the PAC. But let's see about family planning. What is involved in self-care? There's emergency contraception. Combined oral contraceptives, the client can come and they say they have been using this and they want a resupply. Condoms also male and female. 3-month injectable. This is something which is new now. Cyanopress. Drugs for the hormonal imbalance, like in the progesterone and the estradiol, like Yasmin and Meuri, etc. Those are some of the things that one can actually come for self-care in the pharmacy. The other one is ovulation test kits in infertility, monitoring of menstrual cycles, like using of CycleBeams app. Secondary amenorrhea, a client may come and they need to do a pregnancy test throughout pregnancy, and may need to refer to go to a clinician for the management of uterine syncytia, whereby they will need a DNC. STI, HIV, vaginal infections is another area where self-care can work. Syndromic management of STI, HIV test, PrEP and PrEP medicines, treatment of HIV. For vaginal infections, combine antifungal and antibiotic and intrahormonal unless you do HIV test. You can use also Andosh kit, which is with a povidone iron, 10%. If the discharge is chronic, but endorsing with water or soap is not recommended. This is is just an example of betadine vaginal dose kit or Jamendin vaginal dose kit. It contains povidone iron and iodine, and it has both bactericidal, fungal, protozoa, and infection. So if a client comes and says that they've been having a chronic infection, then you may, when doing counseling, guide her to use any of the syndromic management treatment, or you give them an dose kit, which is recommended, and you can also give them a combination of drugs. For erectile dysfunction, Cialis, Viagra is still used, but the question is that the client should rule out heart ailments and hypertension. You should ask them whether they have a hypertensive disease or if they have an heart ailment. For premature ejaculation, naproxetine is the best drug, 60 milligrams, or if you are using 30 milligrams, you combine with a low dose of Viagra, 50 milligrams. And again, these ones, you make sure that the client doesn't have heart ailment or hypertension. Dysmenorrhea and menorrhagia is another area where self-care is utilized. But you may need to rule out a few complications like pregnancy, ectopic pregnancy, adenomyosis, endometriosis, uterine fibroid. So if you are giving any self-care here, then you make sure that the client will just get painkillers, and maybe you give tranexamic acid, mefenamic acid, but they need to go for referral for evaluation throughout hormonal imbalance. You may also require a DNC for histology, so you may need to refer them to a clinician. And Mirena or levonorgestrel intrauterine device might be of help, especially in young persons, which it actually reduces bleeding and also it reduces the dysmenorrhea. Asante, thank you very much. If you have any questions concerning with my presentation, I'm ready to answer them. And, thank you for listening.
Right.
Dr.
Thank you so much, Dr. John Nyamo. Thank you so much, Doc.
Yes.
for that insightful presentation. So we are just going to have a short presentation by DKT, then
Yes.
we'll have the Q&A session. So
Okay,
just
thank you.
give us just a few minutes, then we'll have the Q&A session.
Okay, thank you.
All right, thank you. Helen, karibu. Meanwhile, for our members, kindly share your questions on the Q&A chat. They'll be responded to at the end of this presentation that we'll have right now. Meanwhile, we'll have the presentation from DKT, who are our partners for today's webinar. Karibu, Helen.
Thank you. Good evening, members. My name is Helen Karoki, the Head of Programs and Business Development at DKT International. Mine will be a very quick presentation on our product and the self-care products that Dr. Nyamo has spoken about. And I'll first start by giving you an overview of who DKT International is. And I know by now you already know from our other presentations, we are a social marketing organization with over 30 years experience conducting social marketing activities around family planning, HIV and AIDS prevention, and supplying reproductive health products. We are the world's largest private provider of family planning, HIV AIDS prevention, and safe abortion work. And we mainly work to do only three things: to increase the availability and affordability of a full spectrum of modern family planning methods. Then we would strengthen the supply chain to increase availability of contraception and improve the method mix variety, and to increase demand and inspire new contraceptive users through conducting educational campaigns and marketing activities. Globally, I've said we're over 30 years, but in Kenya, we started operations in 2017 to achieve the three things that I've said DKT works to achieve. Our global presence, we are in over 90 countries so far, globally, with a presence of a DKT office in around 30 countries, but our products reach around 90 countries. So in DKT Kenya, we have three brands. We have Lydia brand. Lydia is a family planning or contraceptive brand. Then we have the Care brand. The Care is our maternal and reproductive health brand. And then we have the Kiss brand. The Kiss brand is our Kiss condoms brand. So today I'm presenting on the DKT self-care products, and I'll start with the misoprostol only. So we have one that is called Misocare, and some of you call it Misocare, which is still fine. It is a pack of 12 tablets, and each tablet has 200 micrograms each, and it's effective for use in obstetric and gynecological and medical conditions. And for medical uterine evacuation, as Dr. Nyamo has said that for a gestation less than 10 weeks, use 4 tablets every 3 hours, up to 3 doses. So this pack is complete for that, that management of a gestation of less than 10 weeks. Then we have Macare. Macare is our brand for the combination of mifepristone and misoprostol. It's a combi pack. It's a combi pack of 1 tablet of mifepristone of 200 milligrams and 4 tablets of misoprostol of 200 micrograms. And like Dr. Nyamo has said, one takes the administration is 1 tablet swallowed orally with water, and on the second day takes the 4 tablets sublingually. This is a complete pack, and for our Macare, it's the original and a quality product from DKT International. The trade price is going for 500 shillings in the market, but you can get a discount from the distributor near you, depending on the distributor that you go to. Currently, Nila Pharmaceutical are selling it for 420. I forgot to mention the price for Misocare. It's 240 shillings, but give or take depending on the distributor who you go to. And then we have the injectable contraceptives. We have the DMPA-IM and DMPA-SC. Our DMPA-IM is branded Lydia Contraceptive Injection, and it's the normal depot that you know, and it's going for 75 shillings trade price. Then for the DMPA-SC, commonly known as Diana Press, it's going for 150 shillings. And I know we have a stock out currently, and it is currently only available at Transwide distributor. So you will not get it at any other distributor because it's been out of stock for a bit. And at Transwide, you'll get it at 150 shillings trade price. And then we have an emergency contraception, which is branded Lydia Post Pill 2. It's a normal formulation that you'll find in the market of 2 pills of 0.75 milligrams of levonorgestrel. It's going for 30 shillings. And again, give or take, depending on the distributor who you go to, you can get a discount. Currently, there's a running offer at all distributors. It's currently going for 20 shillings for, I think, the next 2 to 3 weeks. And then we have our oral contraceptive pills. So this is a new product in the market. It is branded Lydia Desolon. It's a combined oral contraceptive pill. It has 21 oral contraceptive pills containing 0.15 milligrams desogestrel and 0.03 milligrams of ethinyl estradiol. And this, as Dr. Nyamo has said, can be used to manage hormonal imbalance because it has the 2 hormones. And it's a 3rd generation oral contraceptive. It's in the class of Yasmin. And of course, you know, it's the newer the generation, the better the desirable effects, which has all those effects that benefits that are listed there: management of hormonal imbalance, regularization of menstrual cycle, reduces heavy menstrual bleeding and cramps, reduces acne, reduces hirsutism, and it has less weight gain. So it is a 3rd generation for a price of 100 shillings. And again, I know you'll ask why it's a 3rd generation and it is very cheap, but it's because from a social marketing aspect, some of our products are subsidized by donor funding. So that is why you'll get a premium product at a nominal price. So you can get it at 100 shillings from a distributor near you, but can go with 10% more or less. And then we have a Levoplant contraception, and I've included Levoplant for this presentation because there's been a conversation going on about consideration of pharmacists to start administering Levoplant. And because that conversation has already kicked off, I think it's timely that I start talking about Levoplant. It's a product that's mainly administered by obstetricians, nurses, clinical officers, and not mainly by pharmacists. So we have this 2-rod. It has it's a 2-rod marketed for 3 years, and it's going for 998 shillings at the distributor. And then we have our Kiss brand. Our Kiss brand is our condom brand, and we have currently 4 brands. We have Kiss Classic, Kiss Classic Outer. An outer has 24 wallets, and 1 wallet has 3 condoms. It's going for 550 shillings. For Kiss Chocolate, it's going for 800 shillings for 1 out of 24 wallets. For Kiss Strawberry, 800. For any of our scented condoms, they're going for around 800 shillings, give or take 10% again, plus or minus at a distributor near you. So we have new products lined up in the market. We have Kiss Extra Time, which will be coming soon, and we'll be having a lubricating gel that is in the plants and in the works. So if you want to inquire about any DKT product or to access at a good price and you want to know where a discount is running, please take a screenshot of that. Those are the contacts of our medical representatives based all over the country. They'll be able to refer you to a distributor, or they can even be able to deliver so long as they're in your location. And if you want to give us feedback about our products, please write to us at orders@dkthealthcare.org. Please tell us about how it's working, feedback, side effects, the feedback from the women and men. So these are our distributors. I know this is a packed slide. Please take a screenshot. If you want any of our products, it is with these distributors on your screen. And in case, again, I said, if you don't, you're interested in a product and it's not in any of these distributors, refer to the slide of the MedReps, and they'll be able to avail that product to you and even deliver to your facility. Thank you very much. And that's it from me. Back to you, Dr. Mungoma.
All right, thank you so much, Helen, for that presentation. Now we'll move on to the Q&A session. And the first question is from Dr. Suraj, who's asking, is providing Combi Pack to minors legal? Maybe Dr. Nyamu, you could respond to that.
Yes, I think it is illegal, but you know, we are talking about emergency management of early pregnancy complication. That is what is legal for the Ministry of Health. And for us, as long as there is a consent within the law, because currently there is an issue of consent for the minors, whereby it is said that the consent, the minors should have a consent of their parents or guardian. So if a minor comes to the pharmacy or chemist looking for these drugs, including contraception, then they are not, the pharmacists are not supposed to provide because it is not within the law. Currently, there are guidelines which are being discussed about adolescent and young people, but they have not been confirmed whether the adolescents or young people can be able to access these services without the consent of their parents. So I think for now, we can say that the Combi Pack is legal within the laid down policies and guidelines, but the minors should have a companionship, or the consent should be given by the parents or a guardian, but they should not be providing the medicine themselves. And by minor, of course, I mean someone who is less than 17, less than 18 years.
Hezron, are you still there?
Yes, I just, the person who asked the question,
Yes,
is that question clear?
Yes, thank you, Daktari. I'm just checking on Hezron, who has been moderating, and he's gone quiet.
Yes.
Yes. Hezron, are you there?
Hello, sorry, I was having an issue with laptop.
Okay.
Yeah.
Go on.
Is he having any other question? Because I've answered that question. I said that it is okay to give minors, but they should have a consent from the parent or guardian.
All right. Thank you for that, Doc. The next question is from Dr. Jen, who's asking, how can you confirm gestational age, and how many times can a pregnant woman use mifeprostol and misoprostol in a year?
Well, let me answer that one. Probably I start with how many times one can use those medicines. You can use as many times as possible, but I'm assuming that the women will not be getting pregnant every month, but there's no contraindication. You can use them as many times as possible because there are no long-term effects which are known. But for the confirmation of gestational age, for the pharmacists, I would think that they can do history, that is LMP, the first day of the last monthly period. And if you have a gestational will, or if you can calculate, then you'll be able to know where the 10 weeks are, because the limit is the 10 weeks. Although WHO is increasing the limit to 12 weeks, but for now in Kenya, we are still working with the 10 weeks. So that is how you can do a gestational age assessment. If the person is a clinician, or if you want to confirm, then you have to send the client to a clinician who can do vaginal examination or bimanual examination, or they can do an ultrasound, and then they can confirm to you the actual gestation. But if the woman is reliable and is mentally sound, then they can be able to tell you the first day of the last monthly period. Then you calculate going forward, and then you'll be able to know how many weeks. And if you have a gestational will, which I think is everywhere, even in the internet, you can just get an app which can give you an estimated gestational age. and that will be good enough. But if you are not sure, then you can refer this client for examination by a clinician, or you send out to an X-ray or an ultrasound.
All right, thank you so much for that. Another question that is just based on the use of gestational age to dose misoprostol is, do you also consider patient weight?
No. The guideline about the use of Combipac and also use of misoprostol is on gestational age, not weight. I mean, they only talk about gestational age and maybe the size of the pregnancy, but not the weight of the woman.
All right, much. I see that the response was asking the is satisfied. The next question, Dr. Joy, who says, in a patient who's unresponsive to tranexamic or mefenamic menorrhagia, what is the next course of action?
Yes, that's why I said actually when during my presentation, I said that is like a first aid. Those drugs is just like first aid, and some people even give other medicines, and those medicines, if they don't work, then it is better to investigate and find out what is the problem. Because if somebody, for example, has got fibroids, and then definitely because of the uterus cannot contract during periods, then they are going to have severe bleeding and even pain. And sometimes if somebody has got endometrial hyperplasia, then of course they have clots, passing clots, they are going to have a lot of pain. So it is better for the client to be referred to a clinician for further examination and ultrasound, and just make a proper diagnosis. Sometimes they may need to do a DNC, diagnostic curettage, and take the specimen to the pathologist to tell us or to tell the clinician if the client is having an infection or something, because there are several causes of this dysmenorrhea. So it's basically, if you give the client these basic medicines and they don't respond, then you refer to a clinician, a gynecologist or a medical doctor, then you'll be able to find out the main cause of the problem.
Thank you for that. We have a question from Dr. James, who's asking, what's the place of anti-D after an abortion? And should you give following an abortion?
Well, I think what is recommended is that for the first trimester, or even in the second trimester, it is not routine to give anti-D. But if a client knows their brand group, then it is good to give anti-D if at all someone knows the brand group. But if the client doesn't know the brand group, chances of a complication after the first trimester are very slim, and therefore it's not recommended, because anti-D is quite expensive and it can be a barrier to provision of services for these women. But if someone is able to afford to do the barren grouping and rhesus factor, it is important. If someone can be able to afford, it's good to do that test and to avoid a future complication resulting from this rhesus isoimmunization. But the recommendation is that we should not look at anti-D as a necessity or as a must for people who are undergoing abortion management. So basically, what I can answer is that it is not recommended, but it is necessary. So for people who can be able to afford, is good for their health. But if you are not able to afford, you just follow the procedure, or the policy is that during the first trimester, the mixing of the blood is not going to be of any serious consequence. But from second trimester and then trimester, and you are fearing that this can be the case. But I think by that time, maybe the woman may have gone to hospital for checkup or something, and they may know that their status. But if someone does know, then it's important to recommend anti-D, whether it's in the first trimester or the second trimester. Thank you.
All right. Thank you so much, Daktari, for the feedback on those questions been asked. So this question asked before, then Dr. Mungoma to also say something.
Yeah, thank you so much for this session. I think this is an area that we obviously need quite a bit of interaction and mentorship. I think for pharmacists, interacting with medicines, other health products and technologies is important now that we know even these products that are used for medical abortions would be on our shelves very soon. We need to equip ourselves with the knowledge. We need to equip ourselves with the skills. We need to be able to identify different situations, expand our knowledge around this area of maternal health and reproductive health. I want to say that for many, this would be a very new, sort of strange area. But we also want to say that we'll be having again Dr. Nyamu next week to talk about a slightly different area, but related. So just stay tuned. And if you have any other questions or queries around these products and pharmacy's role in post-abortion care, you should attend next week's webinar. I also want to thank Hezron for being very good in moderating this session. I know it's a difficult one, but I think you're gaining very good skills. And of course, DKT, Helen, for supporting us through this session and being able to allow us to provide continuous professional development to the members of PSK. I want to really thank Dr. John Nyamu for taking time off to come and introduce this topic to our members, and we look forward to more partnerships. Over to you, Hezron.
So much, Dr. Mungoma. Maybe we could have Dr. Nyamu. Do you have any closing remarks?
Yes, I think first of all, is that a big thank you for interacting with the pharmacists. I think this is one of the areas that as healthcare providers is long overdue, and we should be getting more interaction, and you should also be inviting us even to your conferences to come and share some of this information, because we believe that pharmacists and doctors and other clinicians, they should be working together. And I think this area of self-care and also the area our president has is insisting on community health care is important. And I'm sure the pharmacists are going to play a very big role. And it is true that these drugs are going to be in the shelves of both the county government hospitals and also already they're in the private pharmacies. But in the county hospitals, the misoprostol will be there, and also mifepristone and the Combipac. So I think it's better for the pharmacists also to be aware of these drugs, how they are used, and how they can tackle some of the conditions which we have listed there in sexual and reproductive health priority areas. So I think this one being a beginning, we should be able to continue sharing knowledge also with the pharmacists because they are giving our clients good services. Now, for them now to be able to be sure, or some of, for example, some of the dosages, we should be able to distribute these guidelines to the pharmacists also, so that they can be consulting. Just the same way we are going to distribute to the healthcare providers, so that they can also consult these guidelines. They are just like reference manuals, and I think it should be able to, each pharmacist should be having, for example, the combi pack, so they can just see where to use this drug and how to use it, and if there are any complications, how you can manage. So I think with those few remarks, I'm waiting for the next interaction with the pharmacists, and I'll be ready to come and share more about the other guidelines which the Ministry of Health has developed. Thank you. Thank you very much.
Thank you so much, Daktari. Helen, do you have any closing remarks? Meanwhile, you could also respond to someone who had asked about the availability of the combi pack at KEMSA and MEDS. Maybe you could respond to that as you give your closing remarks.
I think Dr. Nyamu would be best placed to respond whether it's at KEMSA. I know it's not, or MEDS, because I think he mentioned that there was a procurement that the government stopped and might be reconsidering, I think, procuring again. Dr. Nyamu, am I correct?
Yes. I said that combi pack, okay, misoprostol, has been procured for many years and is being used in our facilities for management of postpartum hemorrhage. But the combi pack was tendered for, but then of course with all the other drugs, everything was cancelled. But right now we are trying to see whether it can be tendered again. But some people went and asked the KEMSA, and they were told that the user has not requested, which means that the Pharmaceutical Society of Kenya should be able to write a letter to KEMSA to say that this product is now with the Ministry of Health has developed guidelines, and we need the drug in our shelves. So I think it's good for people to now lobby and ask KEMSA if they can tender for this product, because the new people who came there, they are saying that the user has not requested. So I think the county government and the Pharmaceutical Society of Kenya and also the drug companies should be able to talk to KEMSA, and then KEMSA is going to tender, and then people can come and procure. I mean, the KEMSA can procure from some of the companies like Indicative. So I think it's something which is in the works, and maybe I'm thinking that maybe by next year there will be a tender, and the drug will be in KEMSA, and then people can be able to procure from KEMSA. Otherwise, it will be the counties will be now procuring from the companies directly, which is not good, because some of the companies might overcharge the county governments. That's why KEMSA is a good place for people to procure, because the charges are going to be standardized.
All right,
Okay,
thank you so much. You can just give your remarks now.
Yeah, thank you so much, Dr. Nyamu, Dr. Ngoma, Dr. Hezron. DKT is grateful for all the attendance and for the great presentation by Dr. Nyamu and you, Hezron, for good facilitation. So, of course, if you need any of our products, especially the combi pack in the private sector, it's currently available with all our distributors, like I said, and it is a high quality product. So I'd like to thank all of you for attending and for always, for PSK always being a partner to DKT. We look forward to supporting you in future informative webinars. I'm sure we've all learned new things. And thank you for the great opportunity, and have a good evening and a good weekend to everybody.
All right, thank you so much, Helen, for the support from DKT and your team. Dr. Nyamu, Dr. Mungoma, asanteni sana for the presentations that you've given us, and we're looking forward to the next session that we'll be having. So as we close, I'd just like to remind our members that next week we'll be having the Global Pain Awareness Week, and our partner Helion will be hosting a series of webinars that will be running from 23rd to 26th of October. And the topics will be on newer trends in pain management, making pain management more inclusive, non-pharmacological approaches for pain management, and finally, multidisciplinary and personalized approach to managing pain. So kindly, we've been sharing the link to the WhatsApp groups. So just sign up for those events as they approach. And lastly, we'll be having regulatory affairs and PV pharmacist meet and greet. This is just similar to what we had recently with the pharmacists in academia and research. So on 2nd of November, which is on a Thursday at 7 p.m., we'll be sending out a link so that you can all register for those pharmacists who are practicing in regulatory affairs and PV. So thank you so much for joining, and have a great evening.
All right, bye-bye.
Bye-bye, thank you.